Hello, everyone. Welcome to the Women's Giving Circle Proposal Presentation Meeting. Boy, is that a mouthful. I'm Sarah Young-Fisher, Chair of the Proposal Review Committee. To our current members, thank you for staying with us during this interesting time. To our guests, we appreciate you joining us today and hope you will become a member of the Women's Giving Circle. I don't know if this is my favorite meeting, but knowing the proposals that are given, that we get a chance to vote for them, we know exactly where our money is going, is so important to me. Today we have 24 staff proposals that we will be hearing. It's a total of $117,000. As Amy just told me that we have $76,500 as of today. So we need to get some more in there with some people by the end of, by the time to vote. We hope to have $85,000 to give out by the end of next month. After today's meeting, you can complete either the paper or the electronic ballot and send it to Pat Cochran. This year, you are able to vote for 10 projects, and you don't have to prioritize them, folks. You just get to vote for them. I want to thank the members of the Circle's Proposal Review Committee for their efforts this summer, reviewing and refining what we are going to be presented with today. It's a difficult job. It's wonderful, but it is difficult. So I'm going to ask Amy to review a few of our housekeeping items, and then we'll get started. Thank you.
Hi, everybody. Thank you so much for logging in and joining us today. We're so happy to have you. For those of you who don't know me, I'm Amy Lewis, Director of Philanthropy here at Hospice and Community Care, and I have the privilege of working with the Women's Giving Circle and serving you ladies who are so entrenched in philanthropy. So first, I just wanted to say thank you for being here. Thank you for all the support that you provide to our organization. And certainly I concur with Sarah that this is a very interesting meeting, and you'll certainly learn more about the projects than you would on any piece of paper that we could share with you, because you'll be hearing it firsthand from the people who care most about these projects. So just a reminder today that we will be answering questions after each presenter has shared for 2 minutes. They'll share for 2 minutes. If you have questions, on the bottom of your screen, you'll see a Q&A. Please enter your questions in there for each presenter. We'll read those questions aloud. If you have any other questions, go ahead and enter those in Q&A, and we'll answer those as they come in to the best of our ability. I think that is pretty much all that we are housekeeping-wise that we need to deal with today. So at this time, I'm going to invite some of our staff presenters in. We'll get started with Paige Payne, Director of Home Hospice, who'll be talking about the Ambulance Assistance Fund. Paige? Are you ready for me to start whenever I'm ready? All right.
You are on.
I'm on. Hi, everybody. My name is Paige Payne. I'm the Director of Home Hospice. I work out of the York office, and I just want to thank you all for the opportunity to present today. I'm presenting a request for a program that we've had in the past, so it's not especially new, but is very vital for the care that we're providing. What I'm asking for is to be able to reinitiate the program for ambulance transportation to and from the inpatient unit and other hospice-related activities when the patient does not have insurance that will cover that ambulance transportation. Largely, those patients are patients that are young. For example, a recent transport that we did was for a 29-year-old gentleman who was living at home with his brother and his nephew. He had a pain spike pretty dramatically and really needed the support of the inpatient unit. Had it not been for the Women's Giving
Circle Ambulance Transportation Fund, we would not have been able to pay for that transport for him to be able to go into the inpatient unit, and perhaps the family would have declined for him to go, because the costs of transportation are pretty high when you're paying privately. I was working with a social worker last week who was talking about a transport to the inpatient unit. We're talking about 30 miles from point to point, being about $1,200 for one direction. Now, our deal with the ambulance company gives us a much better price than that, but nonetheless, it is a vital service and makes it prohibitive for people if they cannot afford or don't want to spend that money for that grant. So that's my request, to be able to renew the grant for the $2,000 that we've requested, so that we can continue to offer this service to patients as we move forward.
Hi, I'm Michelle Jones. I'm the team leader in the inpatient unit. And the inpatient unit is asking for an additional clinical care recliner for our patients to provide a new standard of comfort for the patients and ease of use for the staff. Okay. We received funding for 2 recliners last year from the Women's Giving Circle to trial, and would like to request an additional recliner to trial on our 3rd wing. Due to the overwhelmingly positive response, our ultimate goal is to replace all of our recliners. Our existing recliners are showing signs of overuse and are in need of repair or replacement. The new recliners allow for ease of movement throughout the room or in the halls, promoting comfort to the patients. For example, we had a patient who had difficulty fitting into the old recliner. The new recliner was able to comfortably accommodate him. The nurse easily pushed him through the hall, which allowed him to view our beautiful stained glass windows. Our current recliners do not recline properly, and the tray tables do not fit over the recliners. The clinical care recliner allows for the use of tray tables, which allows for meals or other personal objects to be close to the patient. There are multiple positions with the new recliners that allow for treatment, reading, watching TV, and rest. The use of multiple positions improves upon the quality of care and comfort that recliners we utilize right now are lacking to provide. 4 swivel canisters facilitate transport and maneuverability in confined areas. Directional wheel lock allows the recliner to track straighter with less effort, reducing the risk of staff injury. With this grant, the inpatient unit would be able to purchase an additional clinical care recliner for the unit and utilize them to provide improved comfort and care for our patients. Thank you.
Good afternoon. My name is Grant. I'm the memory support aide at Home Hospice team. I'm requesting some finances for the dementia resource tools. In 2018, the dementia resource team introduced the concept of dementia resources to Women's Giving Circle. We found tremendous benefit from these tools, including robotic cats and dogs and weighted blankets. Based on the positive response from patients and families, we'd like to increase the number of robotic animals and weighted blankets we have available for our staff and volunteers. Research shows that listening to music with dementia patients has emotional and behavioral benefits. Staff and volunteers have found positive responses to playing music for patients and alleviating dementia symptoms. Connecting with those who have trouble communicating. By purchasing MP3 players, we have the ability to offer music to patients. We can leave them in their rooms and in between visits. We're also requesting that the Dementia Resource Tour, it's another resource that we use, which provides an interactive experience with our patients, with our staff and volunteers. And we're requesting this so we can, for a program that we can use for a number of years, in order to give more people an additional, to get more people through. We need additional devices for the training, including goggles, which stimulate macular degeneration, shoe inserts, which stimulate neuropathy, and headphones to simulate decreased hearing ability. Thank you for your consideration and support to our patients and families. Thank you.
Hello, I'm Jean Parsons, Director of Inpatient Services, and I'm here today to talk to you about continuation of funding for the extended stay program in the inpatient unit. Medicare and most insurances only pay for general inpatient level of care for short-term treatment of uncontrolled symptoms, similar to an acute hospital stay. Circumstances exist when a patient no longer meets criteria for inpatient services. However, the inpatient unit remains the most appropriate setting for care as a bridge to either a return home or a nursing home or until the patient's death. When census permits and care is appropriate, hospice offers a short-term stay program for patients who choose to privately pay for room and board in the inpatient unit for a short time. For many with minimal to no financial resources, this is not a viable option, and it causes a lot of angst and distress for the patients and the families involved. A 61-year-old woman transferred to the inpatient unit from LGH with uncontrolled shortness of breath in the setting of COPD. After 7 days of GIP care and symptom management, the patient felt better and no longer met GIP criteria. Her son could no longer care for her at home. However, many nursing homes were not accepting patients due to COVID-19 concerns at the time, and placement was challenging. She remained in the inpatient unit utilizing Women's Giving Circle funds for a time before transferring to a nursing home. Another situation was an 86-year-old gentleman transferred from home to the inpatient unit with sudden functional decline, multiple falls, and exacerbating confusion in the setting of liver cancer. After 4 days of GIP care, his symptoms improved as well as his function. However, he required more care than his elderly wife was able to provide at home. Women's Giving Circle funds were utilized as a bridge to home with added caregiving assistance. We continue to exhaust extended stay care funds each year, and the needs persist for ongoing funds to support patients and families during this very vulnerable time in their life. Thank you so much for your consideration.
Hi, I'm Dee Baker. I just wanted to answer a couple of questions that came up. One has been to ask the participants to state the amount of money that you're requesting for each of your projects. So I just wanted to say that the Ambulance Assistance Fund is requesting $2,000. The Clinical Care Recliner is a $1,725 ask. Dementia Resource Tools is $2,700. And the extended stay is $12,500. The other question was about, can we fund some of these partially? That is the role of the Proposal Review Committee. What they did was they reviewed each of the requests, and each of the requestors had a minimum amount that they could do the project with. And so those have been reviewed. These are the amounts that are being requested from the Women's Giving Circle. So at this point, it is all or nothing. Okay, thanks.
Hello, I am Marcia Schaffner. I'm the Hospice Inpatient Unit Evening Shift Supervisor. I'm here to present fall mats, bedside safety mats. The request that we are requesting is $1,012 to be able to provide fall mats to each unit. Bedside fall mats are safety features that are placed on the floor alongside of the bed. They're made from high impact foam. They're designed to prevent injury from falls. Each mat is specifically made of shock absorbent material that resists compression upon impact. They are waterproof, antimicrobial, flame resistant, and slip resistant. The IPU has a high population of patients that fall. They are on new medications, they are weak, we have a high number of Alzheimer's and dementia patients that come in that are in a new environment. They don't understand why they're in bed, they tend to try and get out of bed and they fall. Putting the mats beside the bed, even though our beds go way down low, putting the mats beside the bed help prevent injuries such as fractures, bruises, skin tears. So even if they're laying sideways in bed, their feet end on the mat. Even if they fall out of bed, they end on the mat. So that helps us keep them safe. Right, thank you.
Hi, I'm Twyla Jancy. I'm the day shift supervisor in the inpatient unit. And I'm requesting a grant for $1,023 for the rinse-free shampoo and conditioning caps. And you guys have helped provide those for us in the past in the inpatient unit. And I appreciate it so much. And I know I don't have to convince a group of women to understand why it feels so good to get your hair washed. The inpatient unit provides baths and showers and whirlpools for our patients, but a large majority of our patients are too ill or too painful or too debilitated to be able to get up and get a shower or a whirlpool. And that's where the rinse-free shampoo and conditioner caps have proven to be so helpful for our patients in the inpatient unit. I asked some of the staff to think with me above what just a clean hair provides with these shampoo caps. And one of the aides said that when she gives a shampoo to a dementia patient, the water, the sound of the water and the feel of the water often causes them to be anxious and fearful. And so the shampoo caps are just a really great alternative to be able to softly put on. It's calmer, it's more relaxing for that group of patients. Another staff member says that she uses them a lot when patients transfer into the inpatient unit and their personal care has been neglected for several, numerous different reasons. The shampoo caps, again, are just a great way to easily and quickly begin the process of restoring someone's dignity with cleanliness. Another aide said that she uses them a lot, just heating them up in the microwave, putting them on the patient's head, and then completes the rest of the bath. And it's amazing how much warmer the patients feel with that warm shampoo cap on their head. She also utilizes the blanket warmer, the blankets that come out of the blanket warmer, to make sure that the patients stay warm during their bath. All these different ways of using the caps are great, and the benefits are great, but even greater is the joy and the appreciation and reassurance that we see from patients and their families and their friends when they see that their loved one has gotten a shampoo and a hair blown dry. So thanks for your consideration.
We do have one question for Marcia. If you'd like to come back up. The question is do you have actual data on falls of patients in the IPU?
Yes, Jean can help us with that. She's the director. Sorry.
Stay here with me.
Okay. Yes, we do. I don't have the data with me, but we track all of our falls and near falls in the inpatient unit. And the fall mats alone isn't the only thing that we use to help with our falls and patient safety. We use one-on-one, close supervision, frequent checks, environmental things that we can do and adjust our environment to make it more safe for the patients as well. But we track all of our falls. Then we investigate all of our falls and see what we can be doing to prevent as many falls as possible in the inpatient unit.
And to prevent injuries.
Absolutely.
How can we prevent the injuries related to the falls?
I have a question about the extended stay funding.
Oh, don't you?
Sorry, Dean.
That's okay.
How many patients can you fund with the full funding of extended stay funding of the $12,500?
That's a great question. At $325 a day for 5 days, that is for one patient at a time. So for the $12,500, it funds about 7.6 patients. So, and we use that every year and more.
Thank you.
Mm-hmm.
That looks like all the questions.
I've seen another question.
Okay.
This question's for Grant. Hi, Grant. The question is, are we able to fund all of parts of your request, or does your request require full funding?
We could do parts. The blankets can be split up, the caps can be split up financially. The VDT is kind of a kit. I think that alone is $500, so we can use it's additional to the one we already have. The cats and the extra blankets would be, we could divide that up then.
Thank you.
Yep.
How about you explain to people about the ballot? We'll have partial and full, right?
Sorry, maybe I misunderstood, maybe I explained it.
That's okay. Hi, there was a question about full and partial funding. This year you received your decision aid. That's the grid that you received. It has the name of each project, the full requested amount, and then the funded requested amount. So earlier this year, as Dee spoke to earlier, the proposal review committee, what's in the dollar amount that's in front of you and in that funded amount column has already been whittled down a little bit to make sure that the Women's Giving Circle can fund as many projects as possible at a more even rate of funding. So they do go in and kind of whittle those in advance. I think the question that was trying to be asked was, so if we were to fund Grant's project, for instance, we would fund the full, whatever's on that full funded amount, $2,700. If it is voted to be funded, we will fund all $2,700. If it's not voted to be funding, we could still accept additional funding in incremental amounts to fund some of those other pieces of the project that Grant requested. Thank you.
Anything else? That's it.
All right.
Thank you.
Thank you.
Please just make sure that you share the amount of funding that you're asking. Okay, thanks.
My name is Laura Carey. I'm a social worker on the Indigo team, which is one of our senior living teams. And this is a previously funded grant, but I am a new presenter this year. We're asking for $3,000 for these two books, gone from my site. And when the time comes, some Spanish and some English. It's been a wonderful resource all these years that you have supported this. Particularly for our palliative medicine patients in the hospital and the other hospital patients for our hospice response team, which are all patients at end of life. We, of course, verbally share end of life changes, what to expect, but they're in such a crisis mode that it very often is really helpful to give them just something small, easy to read in their hand to help them prepare for the death of a loved one. Due to reduced funding last year, we did run out of Gone From My Site. I believe it was 2 or 3 months ago. I think I have the last English copy. We do have some in Spanish, but I think I have the last English copy in our agency. So we'd appreciate your funding. All of our social workers and other staff really love to share these with families, and we always get wonderful feedback. Thank you.
Good afternoon, Women's Giving Circle members. I'm Carol Vandenberg, the Inpatient Unit Volunteer Coordinator as part of the Volunteer Services Department. Thank you for choosing our Hospitality Cart project to present at today's meeting. We are requesting $2,000 to fund this project. Hospitality is a component of hospice. At the inpatient center, families and friends are able to visit their patients' loved ones 24/7. Their presence can assist in enhancing the patient's overall quality of life, yet the hours spent for the caregivers can be long and exhausting. Offering them substantial ready-made meals and snacks, beverages, and something to pass the time, including a magazine, once a day on a cart wheeled in the patient's room by a volunteer may also provide hospitality and comfort to our caregivers. During the COVID pandemic that we are currently in, I have firsthand at the inpatient unit how important it is for families to access drinks and snacks. Currently, visitors are regulated to staying in the patient's room and not able to utilize the kitchens. Drinks have to be taken into them. A hospitality cart filled with, again, microwavable meals, protein, and other snacks including as well as magazines, can provide increased care, comfort to the caregivers during their visits. The care items on the cart can also be available to the patients as appropriate. Thank you for your consideration in funding this new and worthwhile project to benefit the patients and caregivers at the Bob Fryer and Family Inpatient Center. Thank you very much.
Laura, we have a question for you. If you want to come back up. Laura? Laura, a couple of our members are asking how many booklets will be purchased for the $3,000.
I don't have that information in my head, but I can look that up and try to get that answer by the end of this if you'd like.
Okay.
Yeah, thank you. I'm Julia Maton. I'm the music therapist in the complementary therapy department. I'm also the co-chair of the LGBTQ+ resource team. This proposal is for the resource team asking for $1,645 for an educational course. In December of 2019, we started an LGBTQ+ resource team to ensure that we provide inclusive, non-judgmental, culturally responsive care to LGBTQ+ patients and their loved ones, and to promote an inclusive working environment for staff. One of the ways this will be achieved is through staff education. In June of this year, we provided an LGBTQ+ 101 education opportunity for hospice staff. We had 50+ employees attend, and the feedback was that they would like a longer education, they would like more information. So this LGBTQ+ 201 is a 4-hour course to build on the foundational knowledge we already learned. It will look deeper at the experience of the LGBTQ+ community, looking at our individual bias and privilege, culture shifts that are happening, and the legal realities of the community. It will help those who attend better understand disparities in the healthcare system that our LGBTQ+ patients and/or families have encountered that may make them hesitant to seek out care or reveal their identity as a member of the LGBTQ+ community. This opportunity would help our staff work towards providing the inclusive care that hospice and community care strives to provide for our patients and families. Inclusive care means that staff would adopt a structure of self-awareness and change the way they assess, interact with, and support the patients and families they work with. Not asking only because we assume and not discriminating against. A quick example of this would be when asking someone about their relationship status, instead of automatically saying, do you have a husband or do you have a wife, we may ask, who are the people in your life who are important to you? This inclusive care would benefit all of our patients and families, as we do not inherently know who is a member of the LGBTQ+ community. Thank you.
We have one question.
Yes.
Before you walk away. How does the resource team plan to use this education tool?
So we plan to have a 4-hour course. It would be offered either like 8 to 12 or 1 to 5. It would be offered to any hospice staff members, and then whoever would attend would be probably ones who had attended before would have the opportunity for this 4-hour course, and then what they would learn, they would be able to incorporate into their daily work. Does that answer the question?
Good, thank you. And Carol, we have one question for you as well. Are community groups still providing dinners and snacks in the inpatient unit kitchen? She remembers this when working on Good Drive.
Yes, we do have community groups such as churches as well as other organizations that do provide that. However, during COVID, we have not had any groups offer meals in the inpatient unit.
All right.
Good afternoon. I'm Kathy Wazaleski, the Clinical Support Director, and I'm going to present on 3 requests. The first one is MediSets. Thankfully, Women's Giving Circle has supported this several times in 2008. Yes, I was here then. 2012 and 2018. As our census has grown, the need and the utilization has expanded, of course. Medication safety is so critical to every part of what we're doing. This is a Medi-Set. The beauty of the Medi-Set here is there's a sleeve for each day of the week and 4 compartments for each day. The nurse can fill the Medi-Set for the family, and then for a week, they don't need to worry if they did it incorrectly. We teach families and patients how to use these so that they can do for themselves. But we also will go in and make adjustments based on the condition of the patient as their circumstances change. I'm asking for anything for about $2,200. These run about $5 a piece, and I say about because I'm a budget shopper, so if I can do better, I do. So we're looking to get a supply of those replaced. The second one, we'll call safety and security, and this is a new one. Some of the kinds of things that our patients, especially our families, have been concerned about is wanting to keep their family member at home, but concern about them wandering or getting up when they've, I'm the caregiver, I go to the kitchen to return a dish or go to the bathroom, but somebody needs to be watching. So one of the things that we've come up with that would be helpful, and you're hearing it, are a couple of different things to help manage and be aware of what the patient is doing. This is a door alarm, very inexpensive, but serves the purpose, and that chirping is just a small example of the noise that it would make. Hangs on a doorknob so that if someone is trying to exit when they should not be, the family member will hear and know what's happening. One of the other items is one that attaches to the patient. And so this would be clipped on, and this would be attached to their chair, so that if they would go to get up, and you might see things like this used in some skilled nursing facilities. Again, getting up from a chair might not be a safe thing to do without assistance. The other one is baby monitors. We think of their patient care monitors. We're not looking for the really fancy ones. We're not looking to have video. We're really looking at just being able to hear what's happening in the home, in the patient's room, so that the caregiver can attend to the usual things that you would do around your home. Each of these items, the baby monitors, run about $30 a piece. The patient alarm, about $20 to $30. Again, this is market variable, and as we've seen so many things be affected by COVID, I anticipate some variability. The door alarm, about $15 a piece. And so this aggregate of $1,500 will be used for different items. The last one I'm going to say is one of my favorite and innovative, I think, alternatives, options, and innovation for seating solutions. Up until now, we've often asked, and Women's Giving Circle is generously supported procuring power lift chairs for our patient to use. No longer able to get up. But in addition to those, which are a very expensive item, and very honestly, if you've priced furniture or tried to get furniture, it's very difficult to do so right now. One of the items that is a power lift seat assist. The beauty of this item, it's about this big as you can see, can be placed on a chair that is in the patient's home already, can be moved from room to room. If many of our patients move from one family member to another, so this could go with them and we wouldn't have to be moving large pieces of furniture. It's also able to be cleaned, sanitized more effectively than an upholstered item. Thank you to my assistant. The other item that is a seating solution. Now I'm sure someone's gonna ask, what about those waffle cushions that we paid for in the past? Those are still available, but those are ideal for somebody who doesn't have a really tremendous wound. And many of our patients, by virtue of poor nutrition, declining condition, and pressure areas develop, they may have a very substantial sacral or wound or a buttock wound. This is a RoHo cushion. And what's inside are cells that can be inflated and they alternate. It's like an alternating air mattress, a low air loss mattress. It's more advanced than the waffle cushion, would be used for those that have a much more severe wound. The beauty, again, still allowing one of the pieces we want to encourage is if people can be out of bed, they want to be out of bed, and this is a way to help them be comfortable while helping wounds heal. Thanks so much.
Question, are the safety items single use or are they returned to the organization?
Good question. They would be returned to the organization and sanitized.
And can the seat solutions assist large people?
The weight limit on this item is 300 pounds. We are looking for something that's, if there would be a need for something larger.
Okay, great. I also have a question for Julie. Oh, I'm sorry, how much is each chair?
A lift chair or this item? This item runs about $250, the lifting assist. A power, if you think of it as a power recliner or lift chair, those are about $700 or so a piece. And the RoHo, again, that could be, is about $375 to $400. That would not be provided, it would be something we would procure through one of our vendors or our DME provider, so that it would be funds for them to provide for the limit of time that the patient would need it. Very good question.
Okay. Julie, the question is, why wouldn't LGBTQ training be provided by Hospice and Community Care for all staff?
We would love to be able to provide it for all staff. We just started our resource team, so this is kind of our beginnings and we're taking baby steps. And hopefully with this training that we provide, we'll be able to provide more training so that more staff can be educated and be able to take care of our patients and be inclusive.
I think this is also kind of a second level of training because we do provide basic.
Yes, we do. And yes, it's extra training.
I do have an answer for you on the funding for these booklets. As far as how many, it depends on how much funding we get. We do purchase them in Spanish and English depending on what the need is. The cost of this book is $3 each. I do believe we get a small discount if it's a certain number that we order. The cost of this one is $1.72. It can also be branded with our information on the back. I will say, I think most of the social workers prefer this one. It's a little bit simpler, larger print, a little less wordy, but we do like both of them. So depending on how much money we get, we might be able to get around 500 or 600 of each.
Just tell the presenters we're a little bit out of order. Dad's going first.
What can you tell?
Not the audience.
The next presenter will be Deb, because we are waiting for Anne Marie to give all four at the same time. So if you're keeping track along with your agenda, we're a little bit out of order.
Good afternoon, everyone. I brought show and tell today. What I'm asking for is $5,000 for personal protective equipment. And as you all know, and I'm sure you read it in the news almost every day, of how important that is for our staff in taking care of our patients, whether they have COVID or not. So what I thought I would do is just give you a little brief through of what pieces of equipment PPE means, and then also to give you an idea of what some of the prices are, so you would get that. The first one is our box of gloves. One box of gloves contains 100, which would actually be 50 pairs. There's actually 10 boxes in a case, and these come in small, medium, large, extra large. Back in March, our gloves cost us $45 a box. They're up to over $46 a box. So $1 doesn't sound like a lot, but when you think of how many gloves that we go through, every single person that's clinical has boxes of gloves. The next thing is actually our shield, and this actually protects our staff against anything that would fly up against. And this is one way that they can wear them, would be the shield. The other thing is to actually have goggles. The goggles are almost $2 a pair. Then we have the N95 masks. This is probably the one you heard most about. These actually cost over $3 a piece, and we can now use these 5 times, taking them on and off. So that's basically every week, clinical people need to have one of these. We can no longer buy them from the United States. We actually have to get these internationally, and they're called KN95. So if you see that in the news, KN95 versus N95, that's what the difference is. So everyone has these. The other mask that we have is just our surgical masks. Here again, these had a big price increase. We used to have these come a case, and they were $19.39 in March. Now it's $10 more. It's over $29 for just a case of these. And these are basically, you wear it once and you throw it away. We also have gowns. We have cloth gowns for our hospice aides to use for personal care if they want to. Each of these gowns took 3 yards of material, which we had to purchase to have made by our wonderful volunteers. We also have disposable gowns. These are for the rest of the staff to take off and to be able to get rid of. And we also have the gel. So all of these things together is everything that every staff person needs to take care of our patients. And I'm asking for $5,000 so that we can purchase more of these. Thank you very much for your time.
I have a question for Deb before you leave. If you
Sure,
want to.
absolutely, Dee.
Because clearly the PPE is essential. If Women's Giving Circle didn't fund this, who would?
Well, we have 2 options. One is that hospice would pay for, one is that hospice would pay for it. The other one is that we actually do have some money left over in the CARES Act, that the federal government has given us some money. But here again, that goes away come December 31st. So come the first of the year, we would have to purchase all this ourselves. So, okay, thank you very much.
Unmask myself. Good afternoon, everybody. I'm Anne Marie Ackerman. I'm the Vice President of Patient Care, and I actually am going to be reviewing 4 proposals this afternoon. The pediatric proposal actually was submitted by one of our staff nurses, but she has moved on to a different organization, so we continue to have that need as we orient a new pediatric nurse. So I am asking for $1,886. I probably would have just rounded that up a little bit, but she was very precise. And what this would be for is pediatric memory making and grief supplies. And you have previously funded some of the memory making supplies It can be very meaningful for our families of our pediatric patients to work together to create a craft that will serve as a tangible reminder of the child after their death. The variety of things, handprints, an art project, memory shadow boxes, jewelry, or plaster casts of the entwined hands of the members of the family have all been projects that our staff have facilitated for our pediatric patients. This kind of project can engage the family in something non-medical because often the focus is on what's happening medically with the sick child and help create some positive memories for the parents and the siblings. The siblings often feel very left out or worry that something they did caused the illness of their brother or sister. We would like to have the ability to provide simple, age-appropriate sibling gift bags, as well as enhanced anticipatory grief tools to provide guidance for parents on speaking to their children in an age-appropriate way about death. And finally, we'd like to increase our reference materials for staff. We've recently added a full-time physician who has a palliative pediatric experience, and we are exploring opportunities to expand our pediatric program and expand the number of trained staff. So again, we're asking for $1,886 to cover that, and we would really appreciate being able to continue our efforts in providing these for our staff and families. All right. The next one is Clinical Patient Special Needs Fund, and that is $15,000. And this is an extraordinarily valuable resource for our patients, families, and staff as we take care of increasing numbers of patients who don't have the financial resources to meet all their needs. COVID-19 has exacerbated the situation, and social service agencies that we at times are able to access are taxed beyond their available resources. The fund supports provision of translation services for our non-English speaking patients, as well as sign language interpretation for our deaf patients. The fund has been used for a wide variety of needs. It's always our go-to when an interesting need comes up. A couple of the things that happened in the last year, a family with young children where the husband was terminally ill needed to replace their washing machine. It died and dirty clothes were accumulating all over the house. The fund was used to purchase a washing machine for that family. Another patient had been receiving acupuncture treatments to manage her pain and could no longer afford to pay for the treatments, and it was a very effective pain management tool for her and worked better than most medications. So the fund actually paid for those treatments. The fund also paid for transportation for a pediatric patient and his family for a special outing. The needs are varied and often need to be addressed in a very short time. This fund allows us to respond without much red tape to meet those needs and enhance the support we can provide. So again, asking for $15,000 for this fund. All right. Amy's still timing me. Am I good?
You're great.
All right. Gift cards. I'm asking for $7,000 in support of grocery gift cards. The grocery gift cards have become an integral part of the support we can offer to our patients and families who are struggling to meet the financial challenges brought about by their illness. The Women's Giving Circle has very generously funded this initiative numerous times over the past 10 years, and we're extraordinarily grateful for that. The cards allow patients and families to purchase groceries, but also may be used to purchase medications or may be able to help divert funds from food to other necessities like rent or utilities. The availability of the cards allows us to offer support in a very tangible way to meet immediate needs of patients and families. Staff feel greatly supported by this as well because they often struggle to see what's happening in the home, and they appreciate having something to provide for the patients and families to help them deal with the situation they're in. And again, asking for $7,000 for the grocery gift cards. All right, especially medical equipment rentals, asking for $12,500 for this. And I'll just explain a little bit about some of the challenges with the special medical equipment. For most of our patients, hospice is paid on a per diem basis. The daily reimbursement is intended to cover all of the equipment, supplies, medications, ER visits, hospitalizations, and team visits required to care for that patient related to their terminal illness. For most of our patients, their equipment averages about $150 to $300 per month. Some of our patients come to us with very, very specialized needs for equipment. We have a current pediatric patient who is averaging about $2,800 per month just for her equipment alone. The equipment is often used to support significant respiratory issues, but maybe for specialized wound care treatments or for specialized seating for the patient. We are committed to taking care of these patients regardless of how expensive they are or their ability to pay. But this proposal would absolutely help support the organization in meeting these extraordinary equipment needs for these patients. And again, the special equipment rental is $12,500.
So, one question for
Yes,
you,
ma'am.
Anne Marie. Who decides how special needs funds and gift cards are allocated?
Okay, for the gift cards, our social workers are the primary folks that deal with that. They are generally, any member of the team can identify the need, but the social workers really are aware of the financial situations of the family, so they are typically the ones who help manage the gift cards. For the special needs fund, that typically goes through me or a member of the development staff. And I often consult with the development staff to make sure we're not getting out of bounds with how we use that money and that we're pretty consistent in how we're using those funds. But typically that is my decision. Staff give me the story and I usually am the one that ends up saying yay or nay.
Great. Else? We have a question about PPE.
Yes. Yes, how can I help you?
Do volunteers need to wear PPE as well?
If the volunteers are working with staff, are working out with our patients, yes, they do. If they're up in the IPU, they need to wear a mask. So just depending on where they're working or where they're helping us, is they would have the same requirements as our staff does.
But we're not really using patient care volunteers.
Yeah, at this point, we're not using patient care volunteers, but if they would be required to use the same PPE.
Okay, thank you.
Thank you.
Thank you.
Okay. Hi, everyone. I'm Steve Sensnick. I'm the team leader of the supportive care team. As many of you probably know, the supportive care team allows us to provide some of the hospice services to those patients who may not be ready for hospice. Unfortunately, there's not any real insurance coverage for supportive care, both with Medicare, Medicaid, and with private insurance. Although we have a very generous sliding scale that for most people will either eliminate or greatly reduce the amount of out-of-pocket expenses they have, even if a patient comes in on the lowest rung of that sliding scale, that financial burden may create a financial hardship for that patient and their family. This is often why patients decline supportive care services and often wait to the last hours or days of their life to join hospice or to receive hospice care. The Women's Giving Circle has funded us for the last 4 years to be able to provide these supportive care services to those patients and families that can't afford it. You might notice that this year I'm asking for more than I've asked for in the past. For the last 4.5 years, we've been participating with a Medicare pilot program that was providing funding for about 20% of those supportive care patients that qualified. We were told that that funding or that pilot program was going to stop in 2020, and we would lose that resource as a means of funding our supportive care program. And so we were looking for a way to make up that difference for that funding resource. Fortunately, we were given a small extension of the Medicare pilot program, and we now are going to be able to utilize that resource for the next 9 months, after which we will then be without that financial resource. So that's why the amount that I'm asking for is a bit higher this year. So many patients and families have benefited so greatly from supportive care, and your continued support will allow many other patients and families to receive this service.
We have a question. What are some examples of supportive care?
Supportive care is when, just like a hospice patient, a supportive care patient gets a nurse, a social worker, and a chaplain as part of their core team of people that provide care to them. The nurse provides symptom management, the social worker helps to provide psychosocial and family support, and the chaplain helps to support them spiritually. And we all work together to work on end-of-life decision-making and things like that. So it's kind of a package deal you get with supportive care. Go to the next one. All right, I'm still Steve Sensnick with supportive care team. One of the best things that we can do for our patients as a nurse is to provide good symptom management for that patient. One of the things that allows us to do this better is having the correct medications at the correct time to use for those symptoms. As you can imagine, it's often difficult or impossible to get an order for a patient for a new medication in the middle of the night or on the weekend. Our symptom management kits are small kits that live in a patient's refrigerator. Inside of the box is about 15 different medications that we can use at a moment's notice to get a patient comfortable right there and then in their home, and oftentimes we can prevent that patient from needing to go to the emergency department. A hospice patient receives this kit as part of what hospice provides. A supportive care patient, on the other hand, continues to pay for their medications same way they've always done in the past. So the cost for the symptom management kit needs to be carried by the patient. And it's not expensive, it's only $35, but for some folks, that can be a financial hardship, and they choose not to have these kits in their home, which then handicap our nurses as we're trying to do our job and manage those patients' symptoms. The Women's Giving Circle generous grant in the past has provided these for patients who can't afford them. And so we're asking again for some money to help provide these kits to those patients that are not able to afford them in their home. But wait, there's more. Your financial grant not only provides this kit for our supportive care patients, but once that patient transitions into the hospice program, they can continue to use this kit, and therefore hospice doesn't have to rebuy the kit when that patient's admitted to hospice. So you get a twofer. And so we just want to thank you for your continued support of our supportive care program.
Another question, is there a chance that the pilot program may be extended again?
We don't know. We had no idea until 2 days before it was supposed to stop that they were going to give us an extension. We're now going to be able to have patients come into the program and utilize that pilot program until June of 2021. And so if Medicare decides to extend it, they may keep it a mystery until that point too. We don't know. But we don't expect that there will be that.
Could you share how much you're asking for the kits?
The kits cost $35 each, and it actually includes 2 boxes. One is a bowel kit for obvious reasons, and the other one is the symptom kit for all the other symptoms that we might come across. And we get them from Health Direct Pharmacy, and they deliver them for $35 each. I'm asking for $3,500, which would provide 100 kits. And we have probably in a given year, we have about 700 supportive care patients. Most of those patients will choose to purchase them on their own, but this is for the patients that can't afford to do that.
And what happens with the kits if not used by the patient?
They get disposed of by our team at either when the patient dies or when they're discharged. We dispose of the kits at that point.
Another question, do we monitor the use of those supportive care kits?
We do. The patient's physician orders the kit, so every medication in this kit needs to be approved by the physician, and then us nurses make the determination of when that patient's symptoms require that medication. It's only a very tiny amount of each medication for each of those medicines, so there's not a lot to go wayward and not go where they're supposed to go. But it is usually enough to get through the night or through the day until we can get a larger supply for them. Thank you.
Hello, I'm Kathy Eby. I'm the Director of Education here at Hospice and Community Care, and I am requesting $1,000 for staff to be able to participate in what's called validation therapy. Validation therapy is a way of communicating with people who have a diagnosis of dementia, and a way of acknowledging them by words and actions and respect and empathy, rather than embarrassing people who are forgetful and not on their best game. So I'm seeking funding. This $1,000 will have people attend a full day session where we will have a certified trainer the trainer is certified in the Naomi Feld validation method. The first day, the participants will learn the 4 phases of resolution, and then they will go out and practice that with the patients that they see and return for 3 other half-day sessions spread over about 3 months that will, they'll talk about the patients that they've seen, they'll identify the phases that those patients were in and how they were able to communicate or reach that person. So we offered this in a much larger session about 7 years ago, and it was received very well. But because the entire program took an entire year to complete, it was just really very, very long. So I've spoken with the instructor who's willing to really kind of individualize the instruction for our staff.
We have a question. How many dementia patients do you serve?
A lot. I don't really know the number per se, but it's a good portion of the people that we see will have a diagnosis of dementia on top of their terminal diagnosis, and sometimes the dementia is their terminal diagnosis. Okay. Thank you.
Hi ladies, I'm Allie Bucher. I'm the communications manager, and I'm seeking funding for $10,000 for the virtual tour of the Bob Fryer and Family Inpatient Center. So I'm going to begin by reading you an excerpt from a letter that we received from a patient family whose father was in the inpatient center. He spent 1 week in your facility, I think your place is great. It reminds me of a home environment, the full kitchen to a place for families to sleep in the room with patients were so appreciated. I've told neighbors and coworkers all about this. This patient and family were so fortunate to see and experience firsthand the beauty and comfort of the inpatient center. We had a similar situation where a patient was in need of care that would be best provided in the inpatient center. Their family was out of the area, but knew that they didn't want their loved one in a facility by themselves surrounded by 4 bare walls. So because they were unfamiliar with the center and not able to see it beforehand, they opted to have their loved one continue to receive care where they had been calling home. This patient and family missed out on the benefits and amenities of the inpatient center. And this is why I'm seeking funding from you today for a virtual tour of the Bob Fryer and Family Inpatient Center. Sure, a photo is worth 1,000 words, but a video can tell a story. It can transport the viewer to that experience. This tour will begin in the foyer where families and patients will be greeted by volunteers. It will then showcase the patient room and explain why certain features were designed the way they were to best meet the patient's needs. It will then show the kitchen and screened-in porch where families can break bread together. It will also show the living areas where families can find respite, as well as for those families who are out of the area, they can stay connected through Wi-Fi. The video will be housed on our website and will be used by hospice staff to help educate patients and families. It will also be shared with physicians and specialists from the community. So I hope you will consider funding the virtual tour of the Bob Fryer and Family Inpatient Center so all patients and families don't miss out on the quality care and home-like atmosphere we provide at a time when it is most needed. Thank you.
Thank you.
Good afternoon. I'm Tracy Wheatley. I'm the Director of Home Hospice, and I'm asking for $1,500 so that we can maintain our Level 5 We Honor Veterans program. Our national organization about 13 years ago went along with the VA, the Veterans Administration, who asked us to provide better care for our end-of-life veterans. And we have participated in that program since then. Until last year, there were only 4 levels of the We Honor Veterans program. We achieved our level 4, back in 2013. Level 5 takes us to a whole different dimension, and we are asked to do more public education as well as working with our Vietnam veterans. So I'm asking for the funds to help with some of the programming that we've done in the last year. We provided education to the community on Vietnam veterans in regards to moral injury, stress, and suicide prevention for our Vietnam veterans. Sorry. We have also participated in laying reefs down at the Fort Indiantown Gap over Christmas time, and those funds are also going to be utilized for those. It will also help with education for our staff so that we can better provide that care for our Vietnam veterans at end of life. Thank you.
Hello, my name is Jacqueline Builder. I'm volunteer coordinator at Hospice and Community Care in the Volunteer Services Department. I want to thank the Women's Giving Circle for past, I did introduce myself, right? I want to thank the Women's Giving Circle for supporting this program in the past. The materials include military certificate, a United States Star, veteran service pin. This goes out as part of the pinning. Additionally, Veterans Day is coming up. Our vet-to-vet volunteers will honor all of our patients by delivering a wooden rose, flag, card, ribbon. This will be a no contact. This will go into the patient's mailbox or front door. New this year, we did add lawn flags on July 4th. So we were able to use funds to provide this to all of our patients that are veterans. New to the proposal this year, my proposal is, it was initially $3,100. The Women's Giving Circle allowed me to ask for $2,500. I am asking for 3 pairs of virtual goggles for our patients. Our vet volunteers will assist so that they can have a 360-degree panoramic view of the war memorials at the National Mall in Washington, D.C. And it's such an important program because a lot of our veterans are too ill to go there themselves, and this provides closure to them. So this is a fantastic program. I'm so very thankful for all the funding in the past, and I thank you for your contributions.
I'm Paula Merker. I'm an LPN Indigo Home Team. I'm asking for $1,172 to get my wound care certification. I've been working with MG Lomboy, our certified nurse practitioner. The patients that we take care of are, their disease progression will most likely lead them to have some kind of wounds or skin breakdown. Our census is extremely high now, and our patients are in need of our services, and we don't have enough staff to provide all of those cares that they need. And in our senior living facilities, they are using more aggressive approaches to wound care, and we want to use our palliative approaches for less invasive things, so they don't have to go through the painful surgical debridement and things like that. I want to be able to use my skills to empower the families that we serve at home to be able to provide wound care to their family members, give them the education they need to feel comfortable to provide the care and be educated to feel that they can take care of their loved ones when we aren't there.
All right, we have a question for Kathy about the dementia training. The question is, why wouldn't all staff who care for dementia patients be trained in the validation training?
It's actually a specialty training that is something over and above. They do get some validation and some training on dementia during orientation and ongoing. We do have a virtual dementia tour that is a simulation of what dementia, people with a dementia diagnosis are experiencing, and we put everybody that goes, that comes through orientation through that. So they do get some. This is just another level.
Thank you. And we have a question for Allie. Can you share how you arrived at the $10,000 cost for the virtual tour video?
Sure. So we're actually planning to have 2 separate videos. So the first one will be narrated so that people can go on there and they can just listen and visually see information about the inpatient center. The second one will be self-guided. So similar to if you're looking for at a hotel room where you can go and you can see kind of the 360 view of the room. We'll have that as another option. So we're planning to use a videographer, a professional videographer, to take the filming and do the editing, which definitely takes some time, along with the narration. And then we'll be working with a web development company who will then take the information and make it applicable for our website, our patient caregiver app, and other technology that we have.
All right, at this point, we have no more questions. Is it right?
Record time, everyone. Pretty awesome. You should see Amy keeping control of everyone. So I want to thank all the staff who was here today and all that they do for patients and family, and for taking the time to participate in this year's Women's Giving Circle funding process. Isn't it amazing the choices that we have? And also kind of puts it in perspective of all that's needed for the people that we serve. Thanks to all of you for joining us today. Members, please complete your ballots and get them to Pat Cochran. And we hope that we don't have anybody voting on the annual meeting day, okay? If you're not already a member, I hope you will join us. You can make your $500 contribution online or mailing a check to Hospice and Community Care. All gifts need to be received by October 31st so that we know how many members we have so that we can plan for it when we vote. Mark your calendar. Our next meeting is November 5th. I'm not very good about putting things on my calendar, so do it now, please.